many VR surgery is a visualization. So we have Dr. Raju, who talks to us about wide-angle viewing systems and how to get a focused image.
I'll just briefly tell you about how you can go about getting a focused image. First, we need to understand what are the viewing systems that we have. That's the contact and the non-contact. And among the non-contact, which are more commonly used, is the oculus type biome and the ReSight. And you also have the eBio systems. So contact wide-angle viewing systems are the most affordable viewing system. You just have to buy the lens and the inverter. But only thing is you require a very good assistant to assist you during the surgeries. And the focusing is very easy in these cases. Just have to put the lens, invert it, and use your microscope to focus. That's all. However, when you go to the non-contact viewing systems, every viewing system has got a different focusing method. The ReSight, biome are more commonly used. I'll stick to them. Rest of it, office, works on a different principle, and eBios also is totally different. So I'll be telling you more about the ReSight and the biome. So the advantages of the contact, we all know you get a very good image resolution and stereopsis. However, you cannot move the globe too much when you're using a contact wide-angle viewing system. However, you get a wider field of view compared to the non-contact systems. Other less commonly used are the PWL lens and the 132 diopter. These are attached to the headrest of the patient's table. However, these are slightly bulky and they're cumbersome. Although I have developed a adapter for using it to the microscope, still it is nothing, although you get good quality images, but it's nothing compared to what you can get with ReSight or the biome. So the difference here, what you have to see is that you have the lens, that is the high diopter, 132 diopter high resolution lens, and a condensing lens. So this is attached to the head of the microscope, and adjusting the distance between these two lenses is what gives you the focus in a biome system. While in a ReSight, the lens doesn't move up or down. You have the focusing system within the blue color adapter there, what you have. There you have the focusing lenses. So you have to move this knob here to get the focused image. So just the biome, how it is there. So what you have to do when you are going to use a biome, the first thing is to reset your microscope to XY and 0. Then once you're done, then put a visco and then focus on the limbus now. Focus on the limbus and adjust the biome wheel up to the maximum level. After you've done that, then go down and with the maximum zoom, or at least more than the mid zoom, focus on the limbus, and once you focus the limbus, then put the lens into position. After you put the lens into position, then reduce the magnification and just try to get the lens down to get the till you get the focused view. Now, once you have got the focused view, it's important that what you have to do is if you want to increase the field of view, you have to press the focus switch button in a biome. So pressing the focus switch will not lead to a focus. It will lead to movement of the whole microscope up or down. As the microscope moves up, the field reduces. As you go closer to the cornea, the field increases. And the ideal distance should be around 8 millimeters approximately between the cornea and the lens to get the correct focused image. As far as ReSight is concerned, the focusing mechanism is slightly different. So you have the inverted tube. What you can see here is, this is the biome system, the ReSight system, and the focusing lenses are within these two, within the system. Here you can see the wire here, which is motorized. Now what they have done in ReSight 700 is, they have combined the microscope foot switch and to the motor of this one. So as soon as you pull the lens into the system, the inverter gets activated in the ReSight, So as soon as you activate the ReSight, the inverter gets automatically activated, and The lens doesn't move up or down here. The lens is at a particular distance. This is only to prevent for patient protection. This. So, and you can rotate it in any direction that you want. And when you press the focus here in Resight 700, the focusing happens here because the movement of the lenses happen here. That you have to do it manually in Resight 500. So that's the only difference. And if you want to switch to the macular lens, that's the green lens, you just have to swivel it. And here again you have to remember the distance that you have to maintain. It's a 60 diopter lens, so you have to go slightly away from the cornea when you are focusing this lens. And you should not go closer. If you go closer, the stereopsis reduces. So these are the small things that you need to remember when you are doing the using both these systems. Thank you very much.